A bit now about Bangladesh's situation with COVID-19. The country will implement a strict lockdown from Thursday to tackle rapidly rising infections. Now, initially planned for a week, it comes after a surge in cases, particularly in areas bordering India. The Delta variant has run rampant here, and the government wants to avoid a repeat of the devastation it caused in India.
The COVID-19 crisis is pushing this hospital near Bangladesh's border with India to its limit. Relatives desperate to secure medical care and oxygen for their loved ones. The important issue with the patients we're currently seeing is their oxygen saturation levels. They can't be managed properly with only oxygen cylinder concentrators. And if we can't provide them with a central oxygen line, God forbid, the casualties may increase. More than 14,000 people have died in Bangladesh since March last year, and daily infections are currently skyrocketing. After the pandemic hit a devastating peak in India in April, deaths began to rise in Bangladesh. The border between the two countries was shut, but people continued to cross illegally, prompting new infections and fatalities. The virus is now raging through smaller towns and villages in the border regions. By making the tests free, we can now locate the COVID-positive population. People from the villages are coming to get tested, and it's proving the virus has spread significantly in the villages. The surging cases have pushed the government to double down. Restrictions and a partial shutdown began in phases on Monday, leading to a rush of migrant workers to flee the capital, Dhaka. As of this Thursday, all economic activity will be halted and a stringent nationwide lockdown will kick in. But will it be enough to combat the Delta variant and a lack of vaccines? 1 million doses of China's Sinopharm vaccine recently arrived in Bangladesh, but it's still waiting for 20 million AstraZeneca doses from India and for 2.5 million doses of the Moderna vaccine from the US. Before those arrive, mass vaccinations cannot begin.